The EDUCAS WJEC specification asks us to consider the concept of libertarianism with reference to scientific and psychological libertarianism, specifically mentioning Angela Sirigu and Carl Rogers. It should be noted that whilst the work of these scholars is being used to provide evidence for libertarianism, this is not necessarily their goal. It is the case that some may infer that we have free will as a result of studying the work of these practitioners. Angela Sirigu is a French scientist who hit the news in 2017 for leading a team who had woken a man from a 15-year persistent vegetative state. However, prior to this, in 1996, Sirigu published a paper that produced evidence that patients with damage to the parietal cortex, one of the 4 major lobes of the brain, generally found it difficult to predict the time necessary to perform certain finger movements compared with healthy individuals. The conclusion of the paper was that the parietal cortex is important in the thought processes that precede movement. In 2009, a team led by both Sirigu and Michel Demerger performed experiments upon surgical patients that led to the suggestion that it is possible to identify which brain regions are involved in the consciousness of movement. Sirigu's team used mild electrical stimulation on the brains of 7 conscious patients who were undergoing brain surgery to remove tumours in other parts of their brains. When the neurosurgeons stimulated the parietal cortex, the patients reported a desire to move, say by wiggling their fingers, rolling their tongue, or moving a limb. Stronger pulses convinced patients that they had performed these movements, even though their bodies did not move. Further experiments on one of the other 4 lobes of the brain, the premotor cortex, provoked involuntary, unconscious movements in these same patients. In many cases, the patient was not even aware that they had moved. The stronger the stimulus, the more significant the movement, but the movement never became conscious.